Yeah. Hi, everybody. Welcome back. Sorry we're starting a few minutes late. They're just updating the slides back there. So I've passed over my computer, so I'm gonna just wing it again, as I seem to do a lot. But welcome to the breakout session on state level policy interventions. And we have a panel here today, and I will briefly introduce them and outline kind of what they're going to talk about. But then they'll present for about 15 minutes each, and then we hope to have robust discussion on this topic. So there we go. It looks like we've got a slide. Mortality prevention legislation. Whoop, this is not the right one. I mean, they're key pieces, but it might be reorganized. So,
she's on my slides.
So Dr. Dan Friedman is with NYU Langone Medical Center, and he's this. I'm not reading my notes here, Dan. So you're like,
I'm the guy who's been around.
Yeah, he's been around for a really long time and a leader in the field. He also runs the North American SUDEP Registry and has been involved in lots of legislative efforts, and he's on the PAME legislative task force, so he's going to tell us more about that. And Dominique Brown is with EF and runs the, you are one of the advocacy and legislation leaders. Sorry, again, I'm not reading my notes, Dominique.
I handle the state level policy, the director for the state level policy.
Thank you. And Liza, why don't you introduce yourself too?
Am I on? So I'm Liza Gundel. I'm the CEO of Epilepsy Services of New Jersey, and I'm the vice chair of the board for Epilepsy Alliance America. And I'm going to talk about pending and past legislation in states, just to give you some examples.
Okay, and first we're gonna start with Dan, who's going to, and it's a good thing we're starting with Dan because Dan, you really don't need slides, and you're gonna tell us about why we need legislation and why a task force formed around this. Great, thank you.
I don't have to point at slides right now. Okay, so for over a decade, advocates have really sought to address some of these important gaps that the patients and family stories that you've heard earlier today have highlighted through changing policy through legislation, and including gaps in SUDEP disclosure and counseling, research gaps, and epidemiology gaps. And a lot of those efforts have occurred at the state level because the states often have control over their local public health agencies, medical examiners and coroners that practice there. But they also have some controls over clinician behavior. They, here in the U.S., most clinician licensure happens at the state level, and and in many cases these efforts have been primarily driven by gaps realized when a family is bereaved by SUDEP. It wasn't discussed with them. It wasn't coded correctly on a death certificate, and that is the driver for action, and many of them are motivated by these unanswered questions: why they weren't told about SUDEP, why wasn't SUDEP written on their death certificate, why don't we have accurate statistics about the SUDEP death rates in their state or in their country, and why aren't there policies and practices implemented to prevent SUDEP? And the advocates sometimes paired with professionals in their states, with local advocacy chapters, have sought to address these questions with different approaches, and with varied results. some laws have been passed in several states that were successfully passed and signed, at least. Others were attempted and not successful. But it's really been difficult to assess the impact of these legislations. So for instance, in the state where I practice, in New York, there was recently legislation passed that mandated SUDEP risk counseling for high-risk individuals by clinicians who provide the primary epilepsy care for those patients. But there was no mechanism in the bill to assess the impact of that legislation and whether it's making a difference, whether people are actually complying with the law, and so we don't know if it's having its desired effect. There have been several laws that have, suggested mandatory reporting of SUDEP deaths to research registries, but haven't really specified a mechanism for how or provided resources or funding for medical examiners to do this, or have been aware of the different registries that are out there. And so based on these experiences, the PAME group felt that it was important to create a task force to provide resources to those people who are advocating for policy and legislative changes at the local level, at their state, and learn from the collective wisdom of our prior successes and prior successes and failures. So we wanted to first, review the entire landscape of the laws around in the U.S., including what was successful, what is enshrined in legislation, what was unsuccessful, and why. What worked, what didn't work, who are the allies, and who are the stakeholders that we need to engage with as we advocate for changes in the law. Who are the people we need to persuade, and how do we persuade them? What are the best information that an advocate could come to a legislator or their staff with to demonstrate that this is important? What about other people who may they may also need to engage, like death investigators, clinicians? How do we get them on board as well? And how do we find common ground to achieve all the different goals that we want? So with that in mind, the first task of the task force was to look at the current landscape and look at the currently enacted laws. And this is just brief. There's some that focus on the medical examiners and coroners and ensure that they're adequately educated about SUDEP. So in Connecticut and North Carolina, there are laws that say that continuing medical education for medical examiners must include content about SUDEP. Whether that changes practice or not, we don't know. There are also legislative mandates on who and how death investigation should be performed in people who with epilepsy who die suddenly, including in Illinois and in New York, and those often include a statement that SUDEP should be included on the death certificate, with the idea that if SUDEP is on the death certificate, we could get accurate ascertainment about SUDEP rates in different communities. The problem is, as somebody mentioned before, there's actually no diagnostic code for SUDEP. So when all these SUDEP death certificates get funneled up into a state or national vital statistics offices, they're actually just recoded as epilepsy. and because there is no SUDEP specific code. And then these cases must be referred to a research registry like the North American SUDEP registry, but there's limited mechanisms for those referrals to be made, and reliance on a single academic research registry is really not a long-term sustainable thing to do. There's laws regarding disclosure of SUDEP risk to patients, as I mentioned, the New York State law, for instance. There's also interesting laws regarding the coverage of seizure detection devices, including because they have influence over what Medicaid at least can cover in their states. So Minnesota was the first state to legislate that seizure detection devices should be, and their subscription costs should be reimbursed for patients on state public insurance. There are similar laws that are making the rounds in other states. Laws around surveillance, as I mentioned, and then general awareness laws. So these are sort of the survey of the a survey of the kinds of things that are out there. Some of these laws were developed in sort of in isolation, in a sense, local communities, local advocates, and working with their legislatures. Some of them, included discussions with a wider audience. And so as a way of introducing what we think is going to be an important tool for people going forward to make sure that the legislation is effective, I just wanted to survey what was out there. So next we have.
That's great. Liza should come up and share a few examples. Sorry about that.
So help me, I have some extra notes here. Yep. Thank you. All right, so good morning. I'm going to talk about the landscape. So I'll talk about give you a few examples of states that have passed legislation. I'll talk about one state that has pending legislation. I'm going to talk a little bit about lessons learned, and then some testimonials from families that I spoke with. I'll start off by saying that this is certainly not my area of expertise. I am learning so much, and the time that I spent preparing for this presentation and talking to people who were impacted by mortality and epilepsy was really impactful for me. So I want to say thank you for the opportunity to do this. And I will, I'm going to start with my next slide, because I realized that I was not in chronological order in terms of dates. So I'm going to start with New Jersey, which is the state from which I hail, and say that we passed SUDEP legislation in 2013, right? A decade ago, a long time. But I think it's a good example from a decade ago and today that while passing legislation is important, and passing legislation that's going to really enable states to make change that are going to benefit what we're trying to accomplish is really important. So for example, in New Jersey, there is an encouragement, right, that medical data is reported to SUDEP registries. And that's lovely, right? But unless it's mandated and required and collected and analyzed and tracked to make sure it's actually happening, then I wonder how effective and important that legislation is. You'll see that in New Jersey, it even went so far as to facilitate brain donations for SUDEP research. But is that happening? We don't know. And Dr. Friedman says no. So I am happy to report that, going forward a decade, that in 2023, we passed legislation in New Jersey to designate a SUDEP Awareness Day in New Jersey, because I think raising awareness is critical. We've heard a lot about that today, how important it is to get the word out and let people know that SUDEP exists, so that families and individuals living with epilepsy know that they are at risk. So New Jersey is an old law, and there's lots of opportunity to do more good things in New Jersey around SUDEP from a legislation standpoint. I'll go back on my slides to New York. So Dr. Freeman talked a bit about New York. What I'll say is my takeaway from the people that I talked to and the research that I did, thank you, really highlighted something that Dr. Friedman mentioned, and that is that things are often done in isolation. So every person that I talked to said that legislation was born out of grief and the need to be able to take action to try to do something positive and impactful that will ensure that no one else experiences what that family experienced. And so I think that every step is a good step, but we want to make sure that every step is the right step. So in New York, I didn't get a chance to talk to Tim, Natasha's dad, but that family really was the driver of this legislation. And I want to say that, at Epilepsy Alliance America, we talk about one community, one purpose, building local solutions. And I want to say that I think that those three phrases connect directly to this kind of conversation, right? We want to be one community with a focused purpose and build those local solutions, because it is state level legislation, right, that we're talking about here today. So we want to make sure that the legislation that's passed is meaningful and impactful. So in New York, I mean, Dr. Friedman talked about a few of those things. There are some really good things that came out of that, right? That there's information that's been posted on the website for New York State about SUDEP, and that healthcare practitioners were provided with information to ensure compliance and knowledge about SUDEP. So those are good things, but we really want to continue to drive forward in an effort in a way that's going to ensure that, again, we have that impact that's needed to be able to really benefit. Kentucky. So I spent a lot of time talking with Angie in Kentucky, Jamie's mom, and when I get to the testimonial part, I'll share her words with you. But this legislation defines SUDEP. It encourages healthcare providers to share SUDEP information, which again is important, but not a mandate. It does update autopsy requirements and a requirement to send death certificates to the North American SUDEP Registry. So as Dr. Friedman said, there's not a code that helps to connect to that. So that's a step away, but at least that's in place for when the code happens, right? I hope.
I mean, I can comment
Sure.
a little bit, because it was only after the legislation was passed that the Department of Vital Statistics was made aware of it. And so there was a sort of a scramble, with their office to set up meetings to figure out how they could comply with this law. And it turns out they can't, because of the coronial system in Kentucky and the way that deaths are investigated. So, we came up with a compromise that, where they could fulfill their requirement to provide research information that works within their system. But I think, this has been a challenge.
Yeah, it's a great example of a lesson learned from an experience, though. So, hopefully that will drive us forward to make the improvements that we need to have, again, greater impact. So that's great. And then I'm going to talk next about Pennsylvania. So also, not, all of this is bumpy, right? Nothing is smooth and coordinated and connected. But in Pennsylvania, they're working on two pieces of legislation, and I think that's what I saw a lot is that, it's not a lump sum of patient notification and coroner and medical examiner guidance, because that really they really are different tracks, and I'm seeing that being separate pieces of legislation. So, in Pennsylvania, they're seeking a mandate in autopsies to determine cause of death, right, resulting from a seizure or epilepsy, and requiring coroners to indicate SUDEP as the cause or suspected cause of death if the findings align. And then in the other piece of legislation, it's focused on patient notification, and they're meeting with a lot of resistance, and so they are working to align with other legislation. So it's interesting because sometimes a piece of legislation will pass in a related but completely separate area that paves a path for you to accomplish your goals. And so legislation is long and wonky, the development of legislation and passage. And so being connected, I think, with legislators is really important to be able to help us facilitate those opportunities where we can either use other examples to forward our aim, or to kind of ride the coattails sometimes, just happens. So I'm going to move right into the lessons learned. And, so that's not what's there.
Back.
That's the start. I went too far, huh? I'm not moving.
It's stuck.
It's stuck. One moment, please. Oh, thank you so much. Oh, that was good. Huh. All right, so lessons learned. So again, I talked with people in each of these states, and this is what they shared with me, right? So in New York, the SUDEP law led to the creation of a state task force. Beautiful. Updated epilepsy info on the website and distributed a fact sheet to all physicians. There's limited engagement from the medical community and no resources to monitor the law's impact. So yay, but... and then there's uncertainty about whether the law increased awareness of SUDEP in New York. So let's learn lessons from what New York was able to accomplish so that they can do more in the future. And when we're working on new legislation in other states, that we're more prepared because we have this knowledge and experience to reference. And then in Kentucky, Angie talked about the patient notification piece that didn't happen in Kentucky that she's still working on there. And she talked about reaching out for support to advocacy experts around advocacy efforts to be able to work in partnership to be able to advance legislation at the state level, but really highlighted that persistence piece, right? So as moms and dads of kids with epilepsy, you know that persistence sometimes is the only way to get anything done, right? You have to really keep at it, keep beating that drum. And then in Pennsylvania, both Colleen and Andrea said to me that finding a legislative champion who understands your goals can really guide strategy and how important that is. I think that's important in all of the epilepsy work that we do, but certainly in this work. And then, as I referenced just a couple of minutes ago, passing one law can open the door for future legislative progress. And one of the things that Colleen said to me when I was talking with her was, in her state, they have a requirement that if you have a breast cancer diagnosis, you get screened every single year, and you're entitled, paid for by health insurance, to a 30-minute session with a nurse. And
that might be a good model to say there should be regular screening, regular communication, regular sessions available, covered by health insurance. So those were just some lessons learned. And then I'm going to share with you a little bit about the people that kind of helped me gather this information. And so I talked to Andrea Zonnefeld, who's Mark's sister. And Mark died in 2010. And Andrea worked very strongly on the legislation in Pennsylvania that is pending and will continue to work. To honor Mark's memory and to be able to, again, help ensure that that sudden unexplained death in epilepsy doesn't happen to anybody else in the future, right? That's the goal. And when I talked to Andrea, she said that after Mark died, her mom said to her, I couldn't have heard that information. If there was one more thing that the doctor told me, I couldn't have heard it. But Andrea said, I was angry. I was angry that nobody told me and I didn't know. So it is, again, Colleen had said to me, it is like sitting in a doctor's office, and if you're diagnosed with cancer, they're talking about right? They're talking about that. They're talking about death, and that should be happening for epilepsy too. So that's Mark. Oh, don't go too fast. I went too fast. Okay. And then Colleen is Morgan Rose's mom. And she had a lot of really good things to say. I think, she talked about it being a long haul, right? It's not easy. There are lots of challenges. It's very emotional. But that she can't not do it, right? To honor Morgan Rose. And she said she's learned so much. She said, I wish, as many people here have said multiple times, that I knew then what I know now. And she said, you never think it will happen to you. The grief stays with you forever. Life will never be the same. And so she's doing everything she can in the state of Pennsylvania to work to pass legislation. And then the last one is our Kentucky mom, and that's Angie. She's Jamie's mom. And she said that it was her dream to pass this legislation, that she didn't want her daughter's death to be in vain. And she said to me, a life, meaning Jamie, a life that touched so many others goes on forever. And so I hope that, I know Dominique's going to talk more about a call to action than I am, but I hope that all of you across the country who have been impacted by mortality and epilepsy will work collectively together with patient advocacy organizations, with medical professionals, as one community working together to ensure that we can do the work that we need to do to pass vital legislation at the state level. That's me.
Thank you.
Mm-hmm. Can I say one more thing?
Yes.
So I promised I would say something. I literally wrote an orange sticky and then I forgot to say it. So I do want to thank, so Colleen Quinn with Paul's Purple Warriors is a New Jersey family, and she was the one that connected me to Colleen from Pennsylvania and Angie from Kentucky, and I just wanted to say thank you to her. And again, it's that connection across the nation within the community that's really going to get us where we need to go. Thank you.
Thank you. Good morning. I'm Dominique, and I'll be talking about policy recommendations, the advocacy toolkit, and getting started. The purpose of this toolkit is to equip advocates with resources, strategies, and evidence-based recommendations that will drive meaningful legislation. It will provide a comprehensive overview of challenges faced by individuals living with epilepsy and include up-to-date statistics as well as a scope of issues that will provide evidence-based for your advocacy efforts. Advocates are provided with a range of actionable policy recommendations that you can take into your state and use to provide to your legislators in order to pass meaningful legislation. This toolkit includes a well-researched position paper and supports the advocates in effectively communicating the importance of these policies. Over the next few slides, I'll be talking about what the policy recommendations are. Policy recommendations center around education, awareness, and coverage. So for the policy recommendation of education, it aims to ensure that all patients and families and healthcare providers are equipped with accessible evidence-based information about SUDEP and epilepsy-related mortalities while establishing a robust training and protocols for death investigators to accurately identify and report epilepsy-related deaths. In this policy toolkit, it asks that the state health department will ensure all patients and families and healthcare providers receive evidence-based information about SUDEP and other related mortalities. We've heard throughout, a common theme throughout this is that finding out about SUDEP not from your provider, but from someone else within this community. So one of the things is about educating, making sure that the families are educated and they receive that evidence-based information. This information will educate on mortality risk, include contact information for nonprofit organizations offering epilepsy support services, and should be readily made available online. An additional part of the policy recommendation for education is to provide more so for the healthcare providers and the death investigators. So we're asking that the chief medical examiners and coroners association ensure that all death investigators are trained in at least recommendations from the National Association of Medical Examiners and American Board Mediology Death Investigators. They would develop these trainings develop these trainings with a nonprofit organization to educate these medical examiners and death investigators on how to implement protocols to accurately identify and report epilepsy-related deaths and recognize SUDEP and other epilepsy-related causes of death. Awareness. We know the importance of awareness. Raising public awareness about SUDEP and epilepsy-related mortalities is essential to reducing preventable deaths. This policy recommendation emphasizes the need for a state-level awareness campaign to educate the community about mortality risk and to promote risk mitigation strategies, as well as to foster understanding about the epilepsy and its impact. Uh-oh, went too far. No. Coverage. Coverage. The last policy recommendation is about coverage. Eliza kind of touched on this, ensuring access to post-diagnosed education and risk counseling for individuals with epilepsy is vital for improving outcomes and reducing preventable complications. So we're asking that the state Medicaid department ensure coverage for post-diagnosed epilepsy education and risk counseling to support individuals and families with their epilepsy diagnosis. We want to integrate epilepsy education and risk counseling into an already established patient-centered medical home initiative program that's already provided in most states, and establish a case management fee to compensate providers for offering a tailored education and counseling services to individuals with epilepsy, and include epilepsy education and counseling as an incentivized service with managed care contracts by promoting providers to engage and deliver these essential services. This is the State Advocacy Toolkit. We will have them available today, and they're also available online at the PAME website. And a training webinar will be coming about advocacy and how to engage on this. So some initial steps for engaging in advocacy and using this policy toolkit. To take meaningful action on policy recommendation of this toolkit, we kind of have some suggestions. We recommend that you coordinate with others in your state. Collaboration is a key tool in passing meaningful legislation. Working with other advocates and organizations in your state to avoid duplication, such as multiple bills attempting to address the same thing, ensures a unified strategic approach. identifying strategic bill sponsors. And what that means is identifying someone on a particular committee that will be able to move that legislation forward throughout the legislative process, or identifying someone who has a direct connection with epilepsy that will be a strong champion for your recommendations. Sharing your personal story and experiences, as you guys have done throughout this conference, sharing your personal stories and sharing it with the legislators so that they have that feeling and understand why these policy recommendations are important. And starting with the recommendations of this toolkit. So we've outlined education, awareness, as well as coverage. So starting there to ensure we all have a united front as we move policy throughout the states. That kind of gives a unified messaging. And as well as being prepared for compromises. So the legislative process is not from A, B, and C, but ensuring that when you go into a meeting with your various legislators and stakeholders, understand we can outline and make the policy recommendations, and they may tailor it to their state specifically, or because there may be something already on the book. So being open to the compromises and their recommendations. So, really advocating for the strongest legislation to get across, but also being open to compromise. In summary, we want to help advocates who are interested in utilizing this toolkit. So please reach out to, on the toolkit, there's a list of organizations that have worked collaboratively on this. So please feel free to reach out to any organization. And you can also reach out to Allison. Allison, raise your hand. She can also be a good point of contact, and we are here for any questions.
Okay, so I'm so excited to open this up for lots of discussion. But before we do that, I have a question for Dan, and then I'm going to ask Dan to talk about the task force and next steps. But I'm just curious, all this conversation and these examples, thank you, Liza, makes me wonder, how do you measure whether or not a piece of legislation is effective?
I mean, it's a good question, and it depends on what the goal of the legislation is. So if the goal is SUDEP on death certificates, that is easy to measure, but it takes time and resources. And you could look and see what the number was 2 years ago, what the number is now. But that takes resources. If it's changes in behavior, clinician behavior for that may be a little more difficult to measure, right? Somebody has to review charts or notes or attestations, and that also takes resources and infrastructure. And then ultimately, what you really want to measure is, does it influence the outcome we're trying to prevent, right? Mm-hmm. So, what effect do all these interventions have on SUDEP rates? And, as we brought up here and in multiple other forums, we don't really have accurate statistics or accurate ways to count SUDEP rates. And, but that's, that'll be the ultimate endpoint of efficacy of what we're trying to do.
Thanks, Dan. Do you want to wrap us up?
So just, we started with the states because that's where the action has been. We're not charting anything new. We're just trying to provide some organization, some coordination here. But what's really exciting is work, the next steps for the task force, which is focusing on the federal level. And, federal legislation enacted by Congress can have great impact, including on how on CMS, which governs Medicare, and often is what private insurances use as a benchmark for what services they cover and reimburse. It has influences, obviously, on a nationwide vital statistics, how we track epilepsy and epilepsy-related outcomes, funding for agencies like the CDC, who look at chronic disease outcomes and deaths as well. And so we're very pleased that multiple epilepsy advocacy groups have joined together to work with representatives in Congress to come up with a national plan for epilepsy. And this is going to be a legislation that sort of highlights all these different aspects of epilepsy care, and where the PAME task force hopes to be able to participate is address all the places where these things intersect with epilepsy-related mortality and mortality prevention. So
If people are interested, they can pull up that QR code to get involved.
Yes, there's a QR code. So sign up to learn more, see how you can become involved, see how many representatives are currently signed on, like 40.
There are two caucuses. There's a caucus in the House and a caucus in the Senate, and I don't know the exact numbers, but they just passed the House and Senate passed a bill just 2 weeks ago. It's really exciting. So we are hoping that this can get pushed forward by advocates that will create a national plan for the epilepsies and address mortality and so many other important issues.
Okay.
Stan, okay. So are there questions, comments? I know there are a lot of advocates in the audience who have had experience with their own states, and curious to hear from you too about lessons learned, advice from others.
Mary. Sorry. Hello, my name's Lisa Copenspire Ross, and I am part of the Jackson Casey SUDEP Awareness Foundation in Idaho. And I'm the one who filled out our 40-page 501c3 document. And Barb came last year and the year before and started talking to me about wanting to work on legislation. And I freaked out because when you're filling that form out, it basically says you have to say that you're not going to get involved in legislation and politics and all that stuff. So I'm curious to understand what we can do. We're all volunteers. It's not like we're putting money towards legislation or anything. So
That's an important question, I think, from nonprofit law. Dominique, do you probably know
say
that well from
nonprofit
EF?
law, but you're able to you can advocate for legislation in terms of to support the causes that you, but in terms of you can't take a position on a political party or support support a political appointee, for office, but you can, advocate for, legislation. Epilepsy Foundation, we do have our advocacy team, and, we lead several initiatives, but I think, of course there is a fine line in that, but it's more so, I think it's more so on the political side. But I will allow, I hate to put on the spot, but my boss, Laura, if she has any additional guidance, she leads our advocacy team.
Yeah, sure. There are a few nonprofits. I'll give you my card afterwards, but a few nonprofits have really good online guides for election and just general year-round advocacy laws and rules for 501c3s. So I'll hand you my card, and they really summarize things well. But I think what Dominique said is exactly right. You can engage in policy. Obviously, it always has to be non and bipartisan. You have to look at the what, not the who. Is it good for your community? And like she said, some of the biggest rules are around elections. Like you can't endorse candidates, right? Whether it be at the state, federal, or, White House level. But I can share those resources with you. They very easily lay out the rules.
Thanks, Laura. Yeah? Over here?
Hi, I'm Raquel Quarles from Morehouse School of Medicine. My question is, in terms of the state laws, the ones that were presented here were specific to SUDEP, and I'm curious, are there any that have paired with the existing laws that have been passed that are maybe related to seizure-safe schools or epilepsy education? Have any of them been kind of put together in order to help them to pass?
Typically, they stand alone simply because of legislative rules. So, like, it's SUDEP related. Most of the time, like, it falls up under a particular statute, and in most states you can't duplicate statute. You can't fall up under two things. So, like, for education, it's up under education, and health is up under health. So they, it's kind of carved out like that. But is there some overlap? Can having seizure safe school training, help, reduce risk? Absolutely. So it can all fall up under awareness. So it's all about kind of that awareness and education piece. But legislative wise, they stay within their own umbrella.
And then I'll just add that, at state level policy, in my experience, it gets muddy when you try to do too much in a piece of legislation. If you have people that would be opposed to one or the other, it puts you in a tenuous position. So in addition to what Dominique said, just I think being as focused as you can is likely to be more successful.
But if I can add a slightly different, the task force that Dan was talking about, it pulled in a range of different partners interested in this topic. And one of the issues that I think that emerged initially was, let's step back and not only talk about SUDEP, but talk about all epilepsy-related mortality and talk about the problem more globally, thinking that it might be of greater interest to the offices we're talking about and also cover the problem more broadly. So the toolkit, whereas the laws that were presented today were pretty SUDEP focused, because to date, I think more the families that have led the charge have had SUDEP losses, but the toolkit is a broader look at the problem of epilepsy-related mortality. Hi, Lou. Yeah. Hi. You have had experience in Ohio.
There we go. All right. Good morning. So Lou Brossard, I'm out of Cleveland, Ohio, and I just wanted to give another good example of pending legislation, and that is in Ohio. So we are actually very close to the finish line. We modeled our bill similarly to New York, and on January 10th, it passed in the House 91-0, and then it got assigned to the state Senate, where it's currently in the state health committee, the Senate Health Committee. So we're close, and I'm getting mixed feedback on what are the next steps. And but I just wanted to point out, in an earlier slide, so you mentioned find a legislative champion, and that could not be more true, because that's exactly what we did. And we developed a strategy with our legislative champion. And so our approach was to take an awareness bill, which we got passed last year. It's called Brenna's Law, and it's on October 26th every year. It's SUDEP Awareness Day in Ohio, and we chose October 26th just because of that 1 in 26 narrative that we're all familiar with. So that was, we wanted to do a two-prong approach, start with the Awareness Act, and then the next bill obviously would have teeth to it, because the Brenna-Brossard SUDEP Awareness Act, currently in the state Senate, would require clinicians and physicians who are treating and diagnosing epilepsy patients to inform them both verbally and in written form about the potential risk of SUDEP and the factors that you can do to mitigate the risk of it happening to you. So we're very optimistic that this is going to pass. Just circling back, find your legislative champion, figure out who that person is, and make sure that they understand not only your story, but your goals on what you're looking to achieve. And from there, the process, it's not easy, by the way, but it becomes easier when you find that champion. So fingers crossed, this 135th General Assembly in Ohio expires December 31st. So we're really hoping to get this across the finish line. And there's a number of ways, by the way, that you can get it achieved. So there's the tried and true method of, having it pass through committees and then voted on the floor of the Senate, and then the governor signs the bill, right? But there's other ways that you can achieve this too, as I found out along the way, because the Awareness Act actually happened because it was kind of stalled, and then the chairman of the Senate Finance Committee buried it in the state budget. And so I don't care. I mean, it happened. So, exactly right. The goal is to just get it done. So it can occur that way, where they bury it in the budget because there's no financial implications to the Awareness Act. And then you can also ask them to lump it together with some other several other non-controversial bills, so that they're not having to hold hearings on a bunch of separate bills, and they're lumped together, and then it's passed that way too. So we're kind of, again, at the end of the day, I don't care how it gets done, as long as it gets done. So that the mechanisms for passage are multiple, I guess, is the story I'm trying to give you. So thank you for listening.
I want to kind of piggyback off of that, and this is for Liza. You mentioned some resistance in, I think, Pennsylvania, and I wondered if you could speak a little bit more about what was, causing the resistance or the slow up on that bill.
Yeah, so the piece of, this was about the patient notification piece. There's controversy among providers about whether or not they would support a mandate for that. So we're looking to, gain consensus and agreement that would enable us to move that forward. And I'll be really honest with you, like my perspective, not on that specific issue, but on how to advance state legislation is, regardless of that, if you've got the champion like Lou was talking about, even if there is opposition or there's not consensus, you can still drive legislation forward. So I think it's about finding the right people, finding people in the right positions, and sharing your story. The only thing I'll add as an enhancement to Lou is don't wait for to go with an ask for legislation. Develop that relationship with your local legislators so that they know you, they know your story, they know your goals, as Lou was talking about. So it's not. I mean, if you're doing a Suit Up Awareness Day, month or week, you're probably not going to get a lot of resistance, and that'll go through. But anything else, things that are more complicated, that require resources, they deal with issues like, coroners are overwhelmed and they don't want to add more things. I mean, like all of those kinds of things, you're going to have controversy. Some people are going to be supportive and some people are not, for various reasons. So, I think the school safety legislations is a good example too. In New Jersey, the teachers union is going to oppose that at all costs because they have limited resources and they don't want to add to the professional development requirements of teachers. So my point being is that it's rare that there's not some controversy, and you just have to press forward.
I will add that even in situations where it has been unsuccessful because of groups who impacted by this proposed legislation opposing it certainly raised awareness. So this is an example in Connecticut where there was a SUDEP, a medical examiner related bill that was working its way through the legislature that was opposed by the medical examiners and didn't pass, but certainly noticed that we got a lot of referrals from Connecticut medical examiners for SUDEP registry. And which actually, and speaking to them, it's not like that they were opposed to, referring people for research or accurately counting deaths. It's often a question of resources, right? And so they have multiple competing things that they need to do. They have limited resources and budgets, and I think that's always when you're asking for things in proposed legislation. You should ask the question, who's gonna pay for it.
And I'll just add that any form of mandate will likely have an opposition from a key stakeholder. And so one of the biggest things that, since I've been working in this field, advocating for policy, is about the storytelling component of it. The stakeholder has their story and we have our story. And it's how well we present our story, via our champion, as well as the families that are showing up, signing up for the action alerts and sending, the letters to their representatives, not just, that champion will also need support. So, in those states, having that robust, group of volunteers that are going to, provide that support. That's why we say, there's power in numbers. So when you're moving legislation in your state, working with other people within that, because they're going to be able to talk to their representative who can support your selected champion. Your champion may not sit on that committee. It just maybe happenstance may not sit on that committee, but you may have a legislator in your district where you have a push because you're reaching out to them and saying, hey, call my bill for a hearing, or adding it to the budget. Those are those compromises that you'll see where it may not be a standalone, and just starting in different ways and just being patient, because it's not, yes, some bills go through the first time, but then there are states where we've been working 3-4 years on seizure safe schools, and we're fortunate enough to have a champion who has yet to give up on us, and we'll continue to advocate for that. So just being patient and not giving up on those efforts.
Thanks, Dominique. This issue of mandates is really controversial, and I think New York brought it to a head, and it wasn't an effort with one voice, right? Because the medical community wasn't behind it. So I'm curious, Dan, since you practice in New York and you've now lived both sides of it, what could have been done differently, or from your perspective, made it a stronger piece?
I mean, I think, and this affects all, all situations where there's stakeholders who are impacted by proposed legislation that aren't on board. It's not because they don't agree with the goals of legislation. I don't think any doctor in New York would say that people shouldn't be told about SUDEP. Or any medical examiner is not interested in accurately reporting deaths, or any school teacher doesn't want a school that's safe for all children. It's that they don't have the resources, the knowledge, the education to achieve those goals. So I think one thing that I think is important is I identify who those impacted stakeholders would be, and instead of have them as adversaries, make them into allies, and understand what they would need to achieve your goals, and make sure that's part of the legislation. I think that in my opinion, I think mandates about counseling and disclosure, or the encouraging disclosure and counseling about SUDEP and epilepsy safety and all those things, would be much better off if there was funding from state or federal public insurance and private insurance to give us time and resources to do so.
How to incentivize it.
Yeah.
And I'll just add the piece about the stakeholders and working with those stakeholders and reaching out to them prior to introduction and bringing them to the table to have that conversation, because you want to know your opposition before you get to your committee hearing, so that your champion is not caught off guard because there are a group of people coming to oppose the legislation and at that committee hearing, but bringing them to the table. And that's where that compromise comes in, where you're going to have some wiggle room on that. You know, we've passed seizure safe schools in over half the states, and no bill is alike. And that's because we've compromised in the various states. Just like the SUDUP bills that have passed, no bill is alike because of those compromises based on what that state needs, probably based on the stakeholders in those states, as well as the legislators in those states and what they're comfortable with. You know, so really bringing them to the table and having them be a part of that conversation up front is very beneficial.
Hey, one question I had. Again, my name is Kim Parger. I'm an epileptologist here in LA. Looking at some of the things that have passed, you know, obviously educating patients and their families is one of the most important things that we keep talking about. But I wonder, you know, these that require patients be told, especially by a primary care doctor, as I find even epileptologists don't know how to talk to patients and families. So is there provisions for education? Because I feel like we need to go back to how we're educated as doctors even. I don't know how a primary care doctor could do that other than hand off information. I don't know that their education or their experience.
Well, in New York, the law is the person who provides the epilepsy care. So in most instances, that would be a neurologist or an epileptologist, although a pediatrician or primary care doctor in some cases. And there was, but you're right that there's really no provision in the law to say how should the discussion be had. The New York law came with some links to PDFs that you could give patients, but we all know that that's not an effective way to educate people about important things, and we all know that you can have a bad disclosure of a sensitive topic, one that doesn't go well. So even if you're complying with the law, you're not getting the intended effect.
And I'll just highlight that one of the policy recommendations of this toolkit is for provider education to help provide those resources to providers as they are having these conversations. So that would kind of New York, while New York's law didn't have it, based on the work of this panel and the research that was done, that was one of the recommendations that came out of it. Is to be able to support the providers in having those conversations.
And then I'll just say, not only is that critical and essential, but like in the New Jersey law, one of the things that was required was that there be a coroner's education piece too, right? Because they were, unaware and needed. So those education components are really essential to whatever legislation is, whatever the focus of the legislation is, because the
Paired with funding, though.
Pardon?
Paired with funding.
Paired with funding has to be. Absolutely. It doesn't just happen in the ether. Yeah, definitely.
There's a question over here.
Hi, Teresa Prego from EpiWatch, but also, more importantly, the mom of someone with epilepsy who is at high risk for SUDEP, so has had it since age 5, is refractory, and, we worry about her. So the question is, and maybe this falls under the category of trying to put too much in, but under the coverage in the toolkit, was there consideration for covering monitoring devices, and alerting devices? Because I think sometimes there is a reluctance to have that conversation with parents, families about using these because they incur an additional cost, potentially. And then the divide between who can afford and who can't afford is not fair and equitable. So was there consideration for including that, or is that sort of a separate activity, since we've only had success in Minnesota so far?
While it wasn't included in this policy recommendation, the Epilepsy Foundation of America did partner with EF Minnesota to develop a toolkit for local offices and advocates to utilize to work on coverage of seizure detection devices, FDA-approved devices. So we are in the final stages of that toolkit. That toolkit should be ready at the beginning of the year. So we're hoping to, roll that out. And so in that toolkit, it includes model bill language. That model bill language has component of covering the device for state plans, as well as the subscription at 100%. And it also adds an awareness piece. So if and when the state passes, not only do they provide that coverage, but they should educate the providers about the devices. They should educate the families about that they have access to these devices. Because it's not one thing to just say now it's covered up under the DME, coverage part of your plan, but to let people know that they're aware, knowledge is power. So making sure we not only we added that coverage piece, but that awareness to make sure that everyone is aware about that new coverage component.
Excellent. So that would run as its own bill?
Yes.
Okay. Thank you.
That's a great question. Are there others out there?
Yeah, just a quick one. So Barb Casey with the Jackson Casey SUDEP Awareness Foundation, and just thank you so much for your time and energy in putting this toolkit together and what you're doing for the task force. And Lou has already shared a lot of his good work, and maybe some point in Idaho we can get there. But I was just doing a quick Google check on, the SIDS, sudden infant death syndrome legislation that the original bill passed in like 1974. I was curious, how much did you study how SIDS came to be, and how, I know there was that great statistic that showed that maybe it was a nationwide campaign that had the biggest maybe effect in creating awareness around SID. And is that where, I guess, just your take of, is that what we need to get kind of SUDEP to that kind of level? And maybe that's what the federal bill would provide. All right, I had a bunch of questions in there, but feel free to answer which ones. Thank you.
I mean, I will, I think, we often talk about the analogy in SIDS and in terms of public awareness campaigns, and there, obviously there's similarities and there are differences. The main difference is that, the vast majority of people are born in the hospital. So you have a very specific opportunity to intervene, and there's a lot of education that goes on around the birth of the child that has been layered on over the years, everything from car seats to breastfeeding to safe sleeping habits. So it's very and it's generally one group of clinicians, nurses, nurse midwives, and obstetricians that are involved in that, and pediatricians that are involved in that process. And it's a much more general experience to have a child, where epilepsy is very heterogeneous. People develop epilepsies at various stages of life. They interact with the healthcare system in a different way. So it presents a challenge. That said, the idea that you can have a broad public health campaign that influences outcomes, sudden deaths, like we did for SIDS, is encouraging. And certainly people have thought about this for epilepsy. Are there things that are general about SUDEP that could be part of a public health campaign? I think the challenge there is also, how do we measure the efficacy? There is a diagnostic code for SIDS as well, so we could, we know the impact. We know the impact of the public health campaign because we can measure it.
I would just add, in the toolkit, so we worked with a consulting company to pull this together and work the whole process over the past year. And the lovely woman, Katie Collins, who led the process, was just had a baby. And she was just sort of really exercised that she got all this SIDS education and couldn't understand why. So she made the same comparison. But in there, actually, there are a few sentences about comparing to SIDS, just as like a useful tool to talk about it, because we all know about that. And so I think it's a good, like Dan said, it's not a perfect, there are differences for sure, but it's a way in to have the conversation.
And certainly when you're talking about it with a legislator and their staff, you could point, almost everybody has had the experience of them or a family member being educated about SIDS. So you.
There is. Right. It's a great point. We have maybe time for one more comment or question. And then I see you raising your hand over there, so maybe we'll do you after this one here.
I just had a quick comment about communicating this information to families. There is a lot of literature, a lot of nonprofits, a lot of information on the internet about trauma-informed medical communication, trauma-informed care. This is trauma for families, this whole experience. So we definitely encourage clinicians to just Google trauma-informed medical communication so that you can start to learn about how to talk to families about this.
Thank you, Monica.
This is new. Mm-hmm. It seems that a lot of progress has been made after the effort from people on the stage or on the stage. Here, I still want to use the CDC data to want to show you how important this work are. According to our recent study, in the past 10 years, epilepsy-related cost of death increased about 70 to 80%. However, when I talked to one of a medical examiner, he said if we ask him to retrospective to find the missing case, he can find 70% of who has been missing. This is how big gap we have. A second thing is we just recently find that 86% of the cause of death due to the epilepsy is classified as unspecified. So this is indicate that a lot of SUDEP case may be inbred in it because we don't have a SUDEP code, right? So this is how big a significant gap after our effort, what we can achieve. So thank you so much for everyone to make this effort.
Well, thank you for your leadership at the CDC on this. Okay, final words. Thank you all so much. Allison's, where are the toolkits? I hope everybody, pass them out. I hope everyone can grab them and grab any one of us if you're interested in digging in, lean on Lou and others in the audience who've had experience. But I guess a final thing on the evaluation, if this is a topic you're interested in, what more do you need? How do we continue to equip advocates? There's going to be a webinar. You can reach out to PAME and EF and the others, but recognizing, like we've said, this is hard work, but important. Let's continue to think about how we better equip each other and support each other in this work. And to that end, there's also, PAME did a webinar just a few weeks ago with different speakers on it, and that's another resource that can be watched. But anyway, thank you all so much for being here. Thank you, panelists. Have a great lunch.